Dr. Shelly Singh. I'm Senior Consultant, Obstetrics and Gynaecology at Rosewalk Healthcare. So today I'll be talking to you about ectopic pregnancy. Ectopic pregnancy is defined as a pregnancy which happens outside the level of the uterine cavity. We all know that fertilization of the egg with the sperms happens inside the tubes as part of the normal physiology, and then slowly this fertilized ball of cells is pushed towards the uterine cavity where it gets implanted and it starts growing. Now, any pregnancy which happens outside of this uterine cavity is defined as an ectopic pregnancy. Commonest form of ectopic pregnancy is a tubal pregnancy which happens in the tubes. Other sites can be the ovaries, they can happen in the cervix, it can also happen in the abdominal cavity. Now, what are the causes? The causes are any infection which can happen in the tubes because of sexually transmitted diseases. For example, gonorrhea, syphilis, chlamydia. So all these infections which are sexually transmitted can cause an ectopic pregnancy. Moreover, sometimes if you've been using some forms of contraception like the IUCD, which could either be copper containing or it could even be the progesterone containing or hormone containing like the Mirena, if there is a failure of this IUCD, it can cause an ectopic pregnancy. Progesterone only pills as well as emergency contraceptive pills like the I-pill can also, on failure, cause an ectopic pregnancy. Also remember, multiple sexual partners, which again predisposes to infections of the tubes, can cause an ectopic pregnancy. And apart from that, some forms of ART, like an IVF pregnancy, can also result in an ectopic pregnancy. Smoking also predisposes. So these are some of the causes of an ectopic pregnancy. Now, what are the signs and symptoms? We will have a period of amenorrhea, which means that you will not have your periods. There will be some amount of breast tenderness. There will be lower abdominal pain as well. And the usual symptoms of pregnancy will be there. Along with this, sometimes there can be an acute abdominal pain. There can be slight brownish bleeding, which generally is not a very profuse bleeding. And sometimes there can even be things like fainting attacks that can happen in case there is a serious life-threatening complication of an ectopic pregnancy. For instance, when there is a lot of bleeding which is happening inside the abdominal cavity, or if the tubes rupture. Now, what happens? Complications basically mean an ectopic pregnancy does not grow, because we know that the uterus is easily able to increase in size and it is able to accommodate the growing baby, but that's not the case with the tubes. So tubes are very small, fragile areas, and therefore a baby will not be able to grow here. So what will ultimately happen is that either there is an abortion which happens in these tubes, from the tubes there is bleeding which happens into the abdominal cavity, or sometimes these tubes can just rupture, causing life-threatening bleeding inside the abdominal cavity. So most of the times this will end either in the form of a tubal abortion or as a tubal rupture, or occasionally there is something known as a chronic ectopic, in which there will not be much of a problem, but it just forms a kind of a mass inside the tubes. Now, how do we diagnose this ectopic pregnancy? Diagnosis can be done with the help of a urine pregnancy test, which is going to show us that there is a pregnancy. We also ask you to get serum beta-HCG levels done, which are done serially. In a normal pregnancy, we find that beta-HCG levels should double themselves in 48 hours. But if we find that this value is increasing but it's not doubling, it is suggestive of an ectopic pregnancy, and you always correlate it with the clinical signs and symptoms. There is something which is called a transvaginal sonography, as most of you would already be knowing. So a transvaginal sonography can also be done, which is then also going to be showing that there is a mass which is present outside of the uterus and may be present in one or the other tubes. So once the diagnosis of an ectopic pregnancy is made, we come to what is the treatment. Treatment varies from medical ways of treating this to even surgery. The medical ways of treating it is with the help of something which is known as methotrexate. This drug is given in the form of an injection, and it is recommended for ectopic pregnancies which are small and where the patient otherwise does not have a low BP or is hemodynamically stable. So we have the option of medical treatment, which means an injection is given. We may repeat this injection, and then we have to keep following it up by these serum beta HCG levels that I just spoke to you about. So most of the times this medical treatment in carefully selected patients will be effective. However, sometimes it may fail and we may require to do a surgical procedure anyways. A surgical procedure may be required where a medical treatment has failed, or where we find that the patient is hemodynamically unstable, which means that her blood pressure is falling, her pulse is rising, there is generally abdominal distension, and there are a number of features like symptoms when the patient has collapsed. In these conditions, or sometimes even when we do suggest that there is a rupture of the tubes, we require to do a surgical procedure. A surgical procedure can either be done laparoscopically, in which case we either have tube preserving surgery called a salpingostomy, or sometimes we may even require to remove the tube, which is called a salpingectomy. And in places where laparoscopy is not available, sometimes even a laparotomy or an open surgery may be done. So there are various ways of treating this. You should not get very worried about the same. How do we prevent an ectopic pregnancy? First of all, make sure that you do not have multiple partners. That's the most important thing. And make sure that you're using condoms as protection. If you're using some forms of contraception that I just spoke about, like the IUCDs, etc., where if there is failure, there is possibility of a tubal pregnancy, you must visit your doctor right away, because an ectopic pregnancy is a possibility. Smoking should generally be avoided, and make sure that you are in healthy monogamous relationships most of the time.